And we're back for another episode of On the Record with Tiffany, and I have my special guest, Dr. Williams.
Hello.
Luana James Clausen, and Deborah Jarmon. So, my panel of ladies today, we're going to discuss what's going on with our new climate in our country. What do you see as where we go from here? Because we see the numbers going up with COVID-19, and we also know, this has had a huge negative impact on everyone economically, but especially in Black and brown neighborhoods. We've seen a large number of jobs and businesses close. So can you speak
Absolutely.
to that?
Yeah, I mean, yesterday I think is when the Federal Reserve, the chairman came out, Jerome Powell, and just said, we're not going to be going back to normal.
That's right.
Economically speaking, we will not be going back to normal, especially for, those of us who, Black and brown business owners. We're definitely not going to go back to normal. We talked a little bit last time about Goldman Sachs. Goldman Sachs has been doing some fantastic research around, what this global pandemic, this financial crisis has meant for Black and brown communities. And what they found for Black women entrepreneurs specifically was that we only get 47% of a dollar in comparison to white men. So, you look around and you look at the she session, the lasting impacts of the she session, and we know with Black women especially, when we go into business and we do well for ourselves, that money goes back into our communities. The life cycle of those dollars is tremendous. So, it's for me, what it's meant for me as a business owner is to make sure that I invest a little bit more intentionally into, things like giving back, giving food and giving clothing and making sure that people have shelter and those sorts of things. That's how my money's been spent lately, because that's really where the true impact has to be made. There's a lot of recovery that will not be seen for our Black and brown communities.
Mm-hmm. Yeah. And when we're looking at this pandemic, Dr. Williams, what are you seeing as a physician on the front lines dealing with this?
Well, just briefly, I wanted to kind of touch on what Luana was saying. I'm also a business owner, so I invest in real estate, and absolutely, I think the thing that's been so helpful for my rental properties is making sure that I access the cities. There's a lot of programs that people don't know about. Most of my properties are on the east side, west side, affecting, disproportionately Black and brown people, and using the city's resources to really make sure that they know that they're supported and that there's help out there. But I digress. Medically speaking, and I'm sorry, Tiffany, your question was from a medical perspective?
Yes.
What was your question?
What are you seeing? Because tell our audience a little bit about what you've been working with. I thought you were working with COVID-19 and
So I started off an effort of doing testing, community-based testing with something called COVID-SA. To be honest, I had a kind of a bad accident in May, and so I haven't continued with that testing. But what I'm seeing in the communities is that the testing started off in areas in which were more affluent. And so point being is that now I think the bigger problem, and we talked about this a little bit this morning, Tiffany, is that the testing and the resources, I think, aren't going to the communities that are being most affected. And it's a problem. And I wish I had a solution for it, but it's definitely a problem. And kind of, what you were saying earlier, distrust of the system, I'm sure that's probably playing a role in it. But really, the testing is occurring in places, higher socioeconomic places, and kind of these other communities are being ignored.
And it's it is disheartening when you think about that, because the testing is occurring in higher socioeconomic communities, while at the same time, the people that are being hit the hardest are in the lower socioeconomic communities. I mean, once again, the poor, we have 140 million poor people in this country, and they are the last to be served, when in a situation like this, they really need to be the first to be served, because they are the most disadvantaged. They are the most at risk. Uh, that the poor population, we're talking about a prevalence of 1 in 3 would have some form of diabetes, have diabetes and don't know that they have it. 1 in 3 have some stage of kidney disease and don't know that they have it. I mean, they have these incredibly high numbers of a high prevalence to comorbidities that are devastating. One of them would be devastating, but often people have diabetes and hypertension. They have multiple, and we're not seeing anything. We're seeing them vulnerable to COVID-19 and to a sundry of other things too.
No, and that's true, Tiffany. And I think the bigger problem that people don't understand is that ultimately with healthcare, ultimately everybody's going to have to pay for that, because when they enter the system in the emergency room, and that's where I'm working now, I work nights emergency room, when they enter the system, they have to be cared for. And I think that there is a kind of misunderstanding in the general population of, you know, or general kind of lack of willingness to help everybody. But at the end of the day, everybody's going to have to be served. It's just a question at which point are they going to enter the healthcare system. I personally would rather them not enter the healthcare system when they're on death's door and need to be intubated and have to be sent out. And so the best place for them to enter it is, you know, early detection through testing, or even better yet, like we're discussing this morning, Tiffany, how about just early identification? You know, if they have these comorbidities, who's going to be more at risk? Who do we need to focus our resources on? And that's something that I really honestly don't see a lot. It's not happening, unfortunately.
Well, we at Texas Kidney Foundation, I wear another hat during the day. That's it, with TKF. That's exactly what we're doing, is early identification of chronic kidney disease. And we have 10,000 tests that we're bringing to the San Antonio area from a company called Healthzette that we can actually mail out to participants. And they can take the test at home, upload the results on their phone using an app that they simply download, and never come into contact with anyone, and possibly expose themselves to COVID-19, but at the same time identify whether or not they have chronic kidney disease. And then we have drive-up testing, or you can drive up and we can do early identification. And then we also have, we created a healthcare stopgap, because we know that people are coming out of the hospital, coming out of trying to deal with a need for healthcare, but they can't afford it. Sometimes they even have co-payments that are just so high that they can't afford it. So we came up with 35 biomarker tests that test your kidney function, general health, diabetes, so that and triglycerides, so that you know where you are. And we do all of that, and you can see one of our medical professionals for $50. So we've thought through the process, and I think a lot of that is because our team, our board, we have a wonderful board, very active, collaborative board that thought about from beginning to end, what does this look like? What is a full continuum of care? There has to be a continuum of care for people. You can't just test somebody, tell them they have a chronic illness and raise up out, and that's it. you know. So we're doing that, and with our $50 test, that one is through Clinical Pathology Laboratories, another group that we've partnered with, and they have 170 locations across the state of Texas. So we're able to test people in every little nook and cranny of our state, so that we know that you at least have an option. We can at least offer an option, and because nobody's coming to rescue us, but we can rescue each other. Luckily, we're at a stage in this world, in this life, as Americans, that we, as African Americans, that we have enough of an infrastructure that we can step out and start rescuing each other.
Right. And to, just to kind of dovetail with that, I think it's so important what you're saying about, it's so cool that you're offering this, because I think people oftentimes suffer under an illusion that they're, I'm healthy. If I get COVID, what's a big deal? Fatality, 0.4%. But the fact is that if you fall into that category of having those comorbidities, the diabetes, the high blood pressure, I was relating to Tiffany earlier this morning. I had a patient that had, that was healthy, but you just had to look at this individual and you could tell that there was multiple undiagnosed comorbidities. I think that what you're offering, Tiffany, is so awesome, because especially in San Antonio, you see it all the time. People are like, I'm healthy, I look healthy, when really it's just a question of, not to be mean, you haven't been to the doctor. Like, it hasn't been identified yet. And that's a little bit different than actually being healthy. So, yeah, I think it's great that you're offering that, Tiffany, because it really would change, I think, the way in people kind of assess what is the risk of coronavirus, because they're thinking, oh, I'm 30, what's the big deal? But you're 30 with diabetes and high blood pressure, and it's kind of a big deal.
That's exactly right. Every time we talk about this and talk about kidney disease, healthcare in general, and look at our community, there's so many comorbidities that are happening in our community, yet the general attitude is kind of nonchalant about it. Like, you're gonna die from something. So how do we beat that?
It's a hard question, right? Because I feel like, number one, I'm kind of embarrassed to admit this, but I've seen patients who've said that from physicians, it's clearly been communicated, oh, you're Black, you're Hispanic, this is just kind of one of those things that happens to us. And I think that's the first thing, is the attitude of illness, right? Like, that there's a certain inevitability. My mom has diabetes, my dad has diabetes, that's just what happens. I think that's probably the first major thing, is for us to understand, we did not inherit a legacy of illness, right? Like, there's genetics, of course, there's genetics, but then the things that we do are so incredibly powerful. And so I think really just making sure that that message of empowerment is out there, that, yes, your uncle has this, yes, your grandfather has this, but you don't have to accept that. There's things that you can do. You can change how you eat. You can change, your overall lifestyle. I think that would be the thing. And I was telling Tiffany, and Miss Omowale knows this, my life has taken a bit of a detour right now, but health and wellness is really what I think I've been put on this earth to do. And that is the one thing that I wish for our community, is that we understand that yeah, we don't have to accept these illnesses,
You're exactly right, because health and wellness, like, I think prevention is the way of mitigating all of these diseases that we're dealing with, diabetes, hypertension. We have to do preventative measures, not more therapeutics. People don't need more pills. They actually, they may in some areas, but a lot of things can be prevented with what you're putting in your mouth, and what's going on with your body moving. Because like I told you before, 10 years ago I weighed 340 pounds. I weighed
So maybe-
340 pounds, and I was, I looked like a little stuffed pepper, a cute stuffed pepper, but a stuffed pepper. And I thought, and I was just like many of our folks. I thought, big is beautiful. I'm still cute. I had all the Black woman confidence that I've always had, but I didn't need to have it in that sense. I needed to have something. I needed to understand my health and the importance of maintaining it, and I didn't. Nobody was explaining that to me. I actually had to take a stand for myself and make a difference for myself. I want my listeners to come back and listen to my panel of intelligent, beautiful, wonderful women as we talk about what's going on with our community and discuss how we can take next steps, because yes, this is a difficult time, and it's been more of a challenge than we expected, but I think it brings out the best in us when we're squeezed and challenged.
Mm-hmm.
So
Yeah.
let's come on back and listen to our panel as we discuss what our next steps are, and as we discuss our wonderful new president-elect and vice president-elect, and where we hope to see this new group go in the midst of this difficult pandemic. And you're listening to On the Record with Tiffany.